Hello, my name is Usha Devi, and today I will be presenting the strategic plan on patient satisfaction at Johns Hopkins Hospital. First, we should discuss why patient satisfaction is important to begin with. The patient's experience is one element of healthcare that plays a significant role in convalescence outcomes. Some studies indicate that the patient's experience is not a very good measure of the quality of care that providers deliver. Critics of patient satisfaction as a measure of quality care argue that patients have no medical training. Nonetheless, most studies show a correlation between the patient's satisfaction and outcomes. In some cases, researchers found that satisfaction was better at predicting outcomes than adherence to clinical guidelines. Consequently, patient satisfaction has become an essential element of quality care evaluations, with some institutions introducing some patient satisfaction evaluations in their pay-for-performance models of service provision. Evaluating patient satisfaction will help a healthcare institution to improve its services. Better services, especially those that lead to increased patient satisfaction, are likely to lead to better health outcomes and client retention. Patients place significant value on high-quality interpersonal care. Therefore, by improving the quality of interpersonal care provided, they are likely to become loyal clients. Additionally, by giving nurses feedback on their performance, evaluating patient satisfaction can help individual nurses to improve the services they provide. The Johns Hopkins Hospital is a healthcare organization committed to providing safe and high-quality care services to its clients. The facility has capitalized on innovation and research to promote the quality and safety of its care services. For example, the facility established a Center for Innovation in Quality Patient Care with the aim of enhancing the quality of care services delivered to the patients. In addition, the institution has created a learning laboratory to minimize medical errors in the delivery of healthcare services. Conversely, the facility promotes and supports research activities aimed at enhancing optimal healthcare outcomes for its patients. The plan is to improve patient satisfaction such that 90% of patients report that they are highly satisfied with the institution's services. By using the 6th dimension of patient satisfaction, which are good behavior, attention, nursing skill, respecting the patient's privacy, physical care, and medical skills displayed, to create a questionnaire, a provider can measure each patient's satisfaction and institute changes that would help to achieve the set satisfaction goal. The evaluation will grade each medical practitioner based on a set number of patients, which would be a minimum of 30, that they interact with over a specified period, which would be 6 weeks. Although the plan will increase the amount of paperwork the organization deals with, it will enable it to gauge how the clients feel about specific nurses. Consequently, the management will learn how the nurses who are the most successful at satisfying patients act. Because the measured variable, which is satisfaction, is dependent upon the respondent's honesty and recollection, the only factor that the surveyor can control is the time between the respondent's experience and their answers. The evaluation should eliminate confounding elements by controlling for the time between the measured experience and the outcome. Consequently, the respondent should have received services from the institution relatively recently, within the last 3 months. This will ensure that the measured customer satisfaction experience is accurate. Nurses who perform poorly will be given feedback and instructed by more successful nurses, thereby allowing the healthcare institution to improve the patient's level of satisfaction. The Institute will offer the nurses a short course on how to improve satisfaction based on the 6 dimensions of patient satisfaction. This will enable them to change their practice based on specific parameters. Finally, to enhance improvement in the nurse's performance, the management will create a pay-for-performance incentive program. By linking performance to specified bonuses, the nurses are likely to be motivated to improve the services they deliver to the clients. Thank you for your time.